For the abdominal assessment, the first thing you want to do is put your patient flat. But I'm going to ask questions first about the abdomen assessment and GU assessment. Do you have any appetite changes? No. What did you have to eat yesterday? That would be the 24-hour diet recall. Have you had any nausea, vomiting, diarrhea, or constipation? Any abdominal pain? Do you use any laxatives? Have you had any abdominal surgeries? Okay. All right, so we're going to lay the bed down flat. And I'm going to bring the bed up so I don't hurt my back. Okay, so we'll have the patient expose their abdomen, and you're going to first do a visual inspection. So I'm going to absorb the contour of the abdomen, which is flat, can be rounded. Those are both normal findings, flat or rounded. And then we're going to name the regions of the abdomen. So here you have the epigastric region where the stomach is located, and then you have the left upper quadrant where the pancreas and part of the stomach and spleen are located. You have the right upper quadrant, which has the gallbladder and the liver location. Then you have the lumbar area on the right and left, both have a kidney and ureters. Then you have hypogastric, which is the bottom here in the suprapubic area, which hosts the uterus and bladder. Then you have the umbilicus region here, and then the right lower quadrant of the abdomen hosts the cecum or ileocecal valve, and then the left lower quadrant holds the sigmoid colon, where constipation is usually felt as a mass there. And then on the left and right lower quadrants, we also have ovaries if it's a female. So those are naming of your quadrants and the organs underneath. And then we will begin our assessment by also doing an assessment of the skin and looking at any scarring, any striae, any abnormal vascular, like enlarged veins, any pulsations or hernias, and if there is any scars, which would indicate some sort of abdominal surgery that you could ask about. Are there any drains or tubes coming out of the patient's abdomen? Okay, so after that, you're going to begin your assessment with auscultation. So always auscultate before touching your patient. Okay, and I'm going to auscultate with the bell because I'm going to listen to the, I'm going to do the diaphragm. I'm going to listen to the quadrants first and then the vascular areas. So you begin your abdominal assessment in the right lower quadrant, and you're going to listen here, and then go up and clockwise to each quadrant. You're going to listen for 5 full minutes in each quadrant if you do not hear bowel sounds. Normal bowel sounds are active times 4 quadrants, and then you can have hypo or hyper bowel sounds. Okay, so next you're going to listen to the vascular areas, and you're going to listen with your Brewy. You're going to listen up in the epigastric area for the aorta, then the renal arteries, the iliac arteries, and the femoral arteries. Okay, no Brewies are noted over the vascular areas. So that's auscultation. Now we're going to do percussion. Percussion, you're just going to percuss in each quadrant, starting in the right lower quadrant again. Tympany is noted in all 4 quadrants. I may have dullness over enlarged organs. Okay, so after percussion comes palpation. You're going to do light then deep. So light palpation with a couple of fingers in a circular motion. Lightly palpate, and then come back and deeply palpate, deeper than that. Okay. So after deep palpation, you're going to do a few questions, and we're going to do a few tests. So Blumberg sign, I'm going to push in the abdomen. Do you have pain when I let go? So no pain on Blumberg sign, so negative Blumberg, which is rebound tenderness. And then we're going to do the Murphy sign. Take the flat flat part of your hand, place it right underneath the right rib cage, push up underneath the ribs and take a deep breath in. Any pain? Pain on inspiration would be a positive Murphy sign. And then we're going to ask about voiding and bowel movements. When was your last bowel movement? What is the color and consistency of your stool? And then do you have any burning or stinging when you urinate? And what is the color of your urine? Okay, now I'm going to show you how to do Auscultating assessment for tenderness. So I'm going to put the bed back down so she can sit up. And we're going to check for CBA tenderness, the costovertebral angle tenderness. So find the 12th rib. Place your palmar side of your hand here and thump it. Do you have any pain here? Okay, so pain when you thump would be an indication of some kidney inflammation. So after that, your abdominal assessment with the CBA tenderness assessment is concluded.